Okay, welcome everybody. Let's get started as we have a long, phenomenal schedule up ahead for everybody here. My name is Rafael Gonzalez. I'm the moderator. Pleasure to meet you guys. Pleasure to meet everybody here. I'm super excited because I'm sure I'm going to learn, and my focus always is in the context of longevity is what can I learn that day. We're all going to learn something. We have a really, really interesting amount of speakers here that I'm sure you guys are going to really appreciate. We're spanning anywhere from clinical to nutritional to science-based, different experiments, spanning all across through cell therapies, nutrition, diet, all of it combined in one, all in the context of longevity. Granted, my next birthday, I'm going to be 107 years old, so I'm super excited to be able to live just a little bit longer. I'll be really, really happy with that. It's a pleasure and an honor, of course, always to educate and to talk, and I'm sure my colleagues that will be up here too have the same type of sentiment in it. The passion of what we do is the most important thing, so we can project what we love to do and help the masses out there live what I call health span, because there's nothing more important than being healthy, feeling good, and doing what you want to do on a daily basis. So with that in mind, I'm actually going to introduce our first speaker, Dr. Dmytro Klokol, and he is an MD, PhD. People don't understand how difficult it is to get both an MD and a PhD. Really, really difficult task. So much praise and much props to him for what he does. He's actually done this in the context of clinical work, surgery. He is also part of the European Wellness Biomedical Group, which you'll hear actually two individuals here talking about when they come up here and talk about it. And I'm excited to hear him talk. With that, please, let's get an intro, and thank you. He will tell you more about himself, too, and you'll see some of the amazing work he does.
Thank you for the wonderful introduction. Good morning, boys and girls. Can you hear me well? My name is Dr. Dmytro. I'm from European Wellness. I've arrived here less than 12 hours ago after a 35-hour trip, first all across Southeast Asia, then almost 14 hours of layover, and then a trans-Pacific flight here, and just arrived. So I'm actually horribly jet-lagged. I'm leaving 15 hours ahead, because I'm living in a different time zone. But the moment I entered this room, here in the morning and met this wonderful team, I felt very energized and immediately rejuvenated. And thanks for having us here. I'm absolutely thrilled to be here and bring all the news from European Wellness Biomedical Group. It's not our first year here. I've been here first time in 2018, and I think I've missed only a couple of years during pandemic. And last year, when we came to present in RAADfest, my presentation was about immunosenescence, immunodeficiency, and thymus therapy, the reversal of age-related immunosenescence with thymic peptides and thymic progenitor precursor stem cells. About almost 10 years ago, I've written the first stem cell book for European Wellness. It's titled Stem Cells in Regenerative Medicine. But time flies, and there's been a lot of changes. These are the first two the chapters about the Alzheimer's and Parkinson's disease and the stroke and all that were in that book. 9 years ago, the book was published. It's sort of not really a long time, but turns out that science is really accelerating, and there's a lot of data that we have generated in the past 8 years. So we have published a number of articles about neuroplasticity, about treatment of neurodegenerative and neurodevelopmental disorders. And spoiler alert, just before coming here this week, I've completed writing, and I've done also self-editorial work for the book that I've written and passed it to the publisher. The book is going to be titled Stem Cells, The Untold. It's going to be released this year, and I believe that next year when I come in for RAADfest, we're going to bring that book. So Stem Cells, The Untold. And that book is not a volume 2, it's not a chapter 2 for the first book. That's a completely new data, what we have generated in the past few years. And just 3 months ago, we've been to United States, not far from here, to San Diego, on a Global Autism Health Summit, and we've been a keynote speakers there and presented our data. So today here I'm to talk about the neurodegenerative disorders, and also I'm going to touch a bit some neurodevelopmental. I'm going to show you a few slides, and because there's a lot of similarities between the neurodevelopmental and neurodegenerative disorders. So speaking about neurodevelopmental conditions, you see them, the list is far not complete, but such diseases as Alzheimer's disease and Parkinson are perhaps the most frequently occurring and the most debilitating conditions of course, in the multiple sclerosis, in the ALS. There are no good, no benign neurodegenerative diseases. They are all horrible. They are all sort of depriving us of the actual life and just leaving us with a mere existence, right? If you don't have memory and sensations, if you're incapacitated, if you cannot control your movements, what sort of life is that? The same goes for immune system. If your immune system is ruined, your lifetime occurrence of cancer increases, and so immune disorders and neurodevelopmental, neurodegenerative disorders, and cardiovascular, of course, these perhaps the three main groups of diseases that are the most frightening conditions. So before I dive into the actual presentation, I want you to look at these slides. And this is a microscopy of just 1 millimeter of human brain cortex. This has been published. This electron microscopy was done in Harvard University. It was published less than 2 years ago in a journal Science. And this is just 1 millimeter of tissue, which contains thousands and thousands of neurons and thousands of neuronal connections. And it's the disruption in these connections, disorder, functional and anatomical and morphological disorders in this microarchitecture. And this is perhaps the most complex structure in the entire universe, And the disorders in the function and morphology of the structures, they define all those neurodevelopmental and degenerative disorders that you have seen on the previous slide. So can brain regenerate itself? When I went to medical school and did my medical degree, that was in 1990s, we were taught that brain is a post-mitotic organ, same as heart, by the way. Post-mitotic means it has completed its differentiation and it has no self-regenerative or self-renewal capacity. We were told whatever brain cells you have, you die with these cells, and brain cells do not regenerate. Same we are told about heart. And it turns out that regeneration, generation and regeneration of the brain throughout life is not a myth. It's possible. This data is very fresh, very new, and the science of neuroregeneration is only 25 years old. And now we know that there are stem cells that in adulthood turn into the neural progenitor stem cells, which are dedicated to the specific cellular lineage, and from those neural progenitor cells, all three types of the neurons, neural cells, whether it's neurons, astrocytes, or oligodendrocytes, are created. And neurogenesis exists in animal kingdom, and it also exists in humans. And now we know that even until the age of 80 or 90 years old, we are still producing neurons, new neuronal cells. And the formation of new neurons, we call it neurogenesis. These words, neurogenesis, neuroplasticity, they did not exist 30, 40 years ago. These are all new terms. So these stem cells, they produce so-called neural progenitor stem cells that go through the process of maturation and form the actual neuron. And then neuroplasticity is the ability of newly produced, newly differentiated neurons to create connections, and that will provide neuroregeneration, means the repair of the damaged area of the brain, which is possible throughout life. And if you look at this picture here, this slide, you see these two little cherries. One is called the subventricular zone. You can call it SVZ, and one is called the gyrus subgranular zone, SGZ. They are located in a part of the brain which is called hippocampus. And even in the age of 90 years old, even in the age of 100 years old, hippocampus produces about 800 to 1,000 new neurons per day. And then through the olfactory bulb, they migrate, and then they migrate all around brain and perform neuroplasticity and neuroregeneration. So we know that, we know for a fact now that neuroplasticity or regeneration of the brain is not a myth, and it's possible in adulthood. So for us to figure out how to treat neurodegenerative conditions, we need to understand how they develop. And as an ancient Greek philosopher Aristotle said, understanding of the problem is 50% of solving the problem. So let's look at the hallmarks of the neurodegenerative disease. Why they happen? They happen because of the accumulation of the bad protein or aggregation of the pathological protein, because of the synaptic disruptions, because of the aberrant proteostasis, and overall the so-called cytoskeletal abnormality. So it's the morphological anatomical distortion of the brain. Then the altered energy homeostasis. It's malfunction of the brain that is associated with genetic and epigenetic changes and inflammation, chronic low-grade inflammation, and results in neuronal death, the death of brain cells. And the hallmarks of neurodegenerative diseases, they, in a nutshell, repeat the hallmarks of aging overall. But there are some main or the most important hallmarks of neurodegeneration. For instance, the best example would be the accumulation of the pathological proteins. In case of Alzheimer's disease, it's beta amyloid and alpha-synuclein in Parkinson's disease. Synaptic and neuronal network dysfunction and loss of neurotransmitters. Cells, when they die and when they malfunction, they don't produce dopamine sufficiently or acetylcholine. And the loss of the dopamine production is the main driver for the Parkinson's disease, as we all know. Energy metabolism disrupted in brain. You heard that some say that Alzheimer's disease is diabetes type 3. But in fact, it's literally so, because the downregulation of the insulin receptors that happens in the brain, and that causes the disruption of the energy metabolism in the brain. Neuroinflammation, we're not talking about acute encephalitis, encephalitis, we're talking about chronic low-grade inflammation in the neural tissue that all results in a neural death. Now, when we know how neurodegenerative diseases develop, perhaps we can figure out how to reverse them. And indeed, we did create over the years specific protocols how we approach in European Wellness Biomedical Group. The cornerstone of treatment of all neurodegenerative and neurodevelopmental disorders are neural progenitor, aka precursor stem cells. And it's not only in our opinion. Later in this presentation, I'll show you evidence from other researchers and other clinical examples and cases and publications that prove or at least suggest the same, that the main treatment modality for reversal of neurodegeneration are the neural progenitor stem cells. After that, the follow-up treatment, and that takes a very long time. We're talking weeks and years, and at least a few months per year of these protocols of cycles of treatment with the neuropeptides and exosomes. The neuropeptides that we use are both nanomycin and mitochondrial. The mitochondrial peptides specifically upregulate the insulin receptors in the brain cell. And exosome and neuropeptides, and nanopeptides, they have an extremely high ability to penetrate through the blood-brain barrier. We put our patients on a long-term, sometimes even lifelong supplementation with precursors of neuromediators, phosphate donors like creatine, for instance, in a much higher doses than you perhaps heard. Creatine, we're talking about 20 grams and above per day. And the choline donors, the plugs therapy, that is a proprietary, it's our proprietary formula from the European Wellness Biomedical Group. It's a formulation of the phosphatidylcholine that gives that choline group that helps to or participates in synthesis of acetylcholine. Micronutrients and systemic gut detox, that's very important for the gut flora because they produce some of the vitamins B group and also brain neurotrophic factor. And then different devices like the hyperbaric oxygenation that not only increase the oxygen supply to the tissues, including brain, but it also, together with the transcranial stimulation and transcranial electromagnetic stimulation, helps to open up blood-brain barrier, increase the permeability of the blood-brain barrier, so that the stem cells and the neuropeptides and exosomes can penetrate into the brain with a higher efficacy. So, why neural stem cells? Why not the MSCs? Perhaps you all heard about the MSCs that are so easily procured from the umbilical cord, Wharton jelly, bone marrow, and so on and so on. Well, Dr. Arnold Kaplan, unfortunately late Arnold Kaplan, the person who has first introduced MSCs in the early 70s to the medical world and promoted it as a medicinal option for about 30, 40 years. In the end of his career, he realized, and I put the quote here from the interview that he gave in year 2022, just 3 years ago, it was published in one of the medical journals. So he said that he erroneously presumed that MSCs would provide cell replacement. And because they expected that what happens in a petri dish would happen in vivo, but unfortunately it doesn't happen. And in the end of his career, he came to conclusion that it's only the progenitor cells, the cells which are not multipotent. These cells are unipotent and they're dedicated to their specific differentiation potential and cannot cross-differentiate into other tissue types. So these cells, they are just one step away from the final differentiation. And when you implant them or transplant to the patient, they can survive what MSCs cannot do. They can migrate to the site of the injury, to the site of the neurological injury, or maybe stroke, and provide the cellular replacement. These quotes are from a meta-analysis study from Italy and France, where they looked into the neural progenitor stem cells in treatment of Parkinson's disease and stroke, and they came to conclusion that indeed neural progenitor cells can support functional recovery from symptoms of the Parkinson's disease because they can differentiate into the actual neural cells, so-called the dopaminergic neural cells, and not only differentiate, but survive and enter in a close cell-to-cell relationship with the patient's own cells. And not only that, the transplanted cells will influence and they will optimize the existing cells in the patient through the neurotrophic cell growth factor that altogether provides support to the existing neurons. To prove this in human, in actual clinical cases, very, very difficult. It's a huge challenge because to prove the fact that transplanted neural progenitor cells survived, you need to biopsy the patient. And about 20 years ago, such an opportunity came when there was a clinical trial with 12 Parkinson patients, and they undergone transplantation of the xenogeneic neural cells, dopaminergic cells. And then, unfortunately, almost a year after transplantation, 9 months to be specific, one of the patients, a 69-year-old individual, had a 15 years history of Parkinson's disease. And he really dramatically improved in terms of his Parkinson's symptoms. After the transplantation of the neural progenitor cells, he has passed away because of the pulmonary embolism that was not related to the transplantation at all. But because he was part of the clinical trial, one of the subjects, he had to go for the postmortem. So when they analyzed the tissue, they found positive stain for the xenogeneic CD44 antigen. And it was also positive for the tyrosine hydroxylase, which is a dopamine cell marker. And it was positive for the neurofilament 70, which is a marker for the xenogenic exon markers. So they also did the microscopy of the brain. Not only they've identified and with a microscopically, morphologically, and they also confirmed that the cells from the transplantation survive via the immunohistochemistry analysis. And that's 9 months after the transplantation, and patient had tremendous clinical improvements. This is another case just published less than a year ago in a Journal of Stem Cell Transplantation, the year 2024. This is a very fresh case and wonderfully illustrated by a functional MRI. Functional MRIs are not done routinely because it's a very costly procedure, far not all medical centers. It has to be really an advanced research facility that has that sort of equipment. This study was done in a country it's called Ukraine, by the way, last year, in a patient who had suffered a horrific neurodevelopmental disorder. He had a complete absence and sort of maldevelopment of cingulate and temporal arcuate pathways on the left, in the left hemisphere. The patient underwent transplantation of the neural progenitor cells, and these are the functional MRIs you see, left side and the right side of the cingulate pathways. And less than a year after transplantation, the functional MRI in the right slide. And you can see that there has been a complete restoration of the cingulate pathway and a partial restoration of the temporal part of the arcuate pathway, which are responsible for cognition, for emotions, for social interactions, for memory, and so on. In the same article, when the authors analyzed how exactly that happened, they actually managed to prove that transplanted cells did indeed complete and finish their differentiation into the appropriate type of the cells, and they produce the restoration and replacement of the damaged or dying cells via the direct homing effect. And also they provided the paracrine effect because they secreted a lot of growth factors and cytokines that stimulated recovery of the other parts of the brain in the patient. They improved the epigenetic status and also functional, the energy metabolism via the mitochondrial tunneling effect, and also supported regeneration of the patient's own neural tissue, his own brain, via the excretion of the exosomes and the microvesicles and the mRNA that provided the paracrine effect. And that's how the neural progenitor stem cells look when they are produced and cultured in one of the FCTI lab, which belongs to it's a part of the European Wellness Biomedical Group. That's the microscopy of the neural progenitor stem cells. So unlike MSCs, neural progenitor stem cells migrate, they join the systemic circulation, and they can penetrate blood-brain barrier, small percentage, but at least something, unlike the MSCs that do not perform that at all. And through that, they contribute to neurogenesis and regeneration of the brain by creating new neurons and creating new neuronal connections. They provide anti-inflammatory effect by excreting anti-inflammatory cytokines, but also by the modulating immune cells and reducing this so-called microglial activation that triggers the low-grade inflammation in the brain. They also secrete growth factors that produce the neovascularization effect. In other words, the formation of new blood vessel, or that results in improved microcirculation in the brain. And last but not the least, very important, they promote the formation of a myelin sheath around the neurons that increases the speed of a transmission of the impulse by hundreds and thousands of times. What about the Alzheimer's disease? Well, these are the main hallmarks of the Alzheimer's disease, and There's plenty of studies proving that neural progenitor stem cells directly regulate synaptic neuroplasticity and provide the actual morphological repair and rebuild of the brain tissue. They also provide immunomodulatory and anti-inflammatory effects. And that is done via the influence in the astrocytes and the microglial cells, reducing the microglial inflammation. We all know about the beta amyloid plaque accumulated in the neural cells, and that's actually one of the first discoveries in the early 2000s. For a very long time, it was thought that the beta amyloid plaque is actually the cause of the Alzheimer's. Now we know that it's not the cause, it's a consequence, and it's a downregulation of the insulin receptors is the actual cause. But the progenitor precursor stem cells, neuron stem cells, they promote and increase autophagy. In other words, the clearance, the removal of that aggregation, accumulation of beta amyloid plaque. Last but not the least, they provide the epigenetic control and control over the homeostasis in entire microenvironment of the brain, thus, indeed, directly reversing the age of the brain. The beauty of the progenitor stem cell therapy is there are different types of progenitor stem cells. Heart has its own cardiac progenitor stem cells. Brain has its own progenitor cells. Liver has its own progenitor cells. Pituitary gland or retina or thymus gland, kidneys, every organ, every tissue, more or less, has progenitor cells. And by analyzing the status, the health status of every patient with progenitor precursor stem cells, we can create individualized, personalized treatment protocols. When, as we all know, there are no healthy people and there are no people who have only one condition. Everyone is usually has a number, multiple conditions. So with the progenitor precursor stem cells, we can target all of them one by one or in the same time. And that can be illustrated by a very elegant and nice clinical case of a retired police officer who, in the age of 83, in 80s, he has developed dementia, he has developed Alzheimer's. And that was not the only problem, unfortunately. This patient also had cardiomyopathy due to the ischemic heart disease. It was very frustrating for the family, for wife and children, and for everyone, because the person was very active throughout his entire life, and then in the end of his life, when he's supposed to enjoy life, and he actually wanted to travel around the world, and he couldn't do that because he was debilitated with Alzheimer's dementia. He came to us and he did the stem cell treatment, 2 sessions, and you can see the comments from his family physician. The patient became more energetic. Definitely he improved in terms of his cognition, in terms of his mood and his cardiac function. Wife was very happy because it was really an absolute reversal of the condition. Not only his memory improved, because he was forgetting that he couldn't even leave his house, he didn't remember where he put the keys, and there were even cases when he walked out of the house and was lost, so all of that was gone. His cardiac function improved also, the ECG improved, and the echo improved. And objective status, when he was evaluated with the clinical dementia rating, the CDR, and the Alzheimer's disease assessment scale cognitive score, the ADAS cognitive score, we had a reduction from 2 to 0.5. 0.5 is practically norm. And 47, which is a moderate to severe Alzheimer's, reduction to 25, which is almost practically norm. And that person, Eric Brown, he was actually featured even in a local newspaper. And guess what he started doing after the treatment? He went traveling in Southeast Asia because he wanted to visit Buddhist monasteries, and he was sending us these photographs, and he was in touch with us for many, many years after the treatment. Apart from the neurodegenerative disorders, we also developed protocols and treated hundreds of patients with neurodevelopmental disorders. We have published recently in a end of last year and beginning of this year, some statistics about what we have done. In the past, we had 590 patients from 16 countries. Of course, predominantly boys, because neurodevelopmental mostly affects males, about 70% to 30 females in the age of 4 to 26 years. And we did 910 stem cell transplantation. As you see, most of the patients, more than half of the patients, had more than one session. You know why? Because they really like the outcomes. The families, the caretakers, parents, they really noticed huge improvement. And without exaggeration, the therapy response rate with a neural progenitor stem cells is 100%. Of course, it depends on the case, severity of the case, but we yet to see the case which did not respond to the stem cell treatment with precursor progenitor stem cells at all. Please, ladies and gentlemen, I encourage you to visit our website, europeanwellness.eu, and watch the testimonials where the patients and the family members, they give their own testimonies how their life changed after treatment with neural progenitor cells. And you'll see it's categorized, you know, the Alzheimer's and Parkinson and stroke patients and all, and families of the individuals with the neurodevelopmental disorders. By the way, to the date, the oldest patient that we treated with autism spectrum disorders with neurodevelopmental conditions is 32 years old now. You know, it's perhaps one of the oldest patients who has ever been treated in the world. That's it, ladies and gentlemen. We have the booth of European Wellness Biomedical Group. Please visit. There's a lot of information there. And please remember that you don't have to get old as you age, as long as you stay with European Wellness Biomedical. I would be happy to take questions. Please.
Any questions? You're welcome to stand up. There's a microphone back there, please. We'd appreciate it.
Yes, my question is, you said all stem cells are not the same.
Right.
And that's why often you go into the umbilical cord before anything differentiates. So could that be the solution for what you're saying here?
Unfortunately, no, sir. Unfortunately, no. The umbilical cord or the Wharton jelly, it's all the MSCs. Yeah, mesenchymal stromal cells. You see, Arnold Kaplan gave, first they were discovered in the late 60s by Professor Friedrichsen. And in the early 70s, Kaplan introduced those cells to medicine, and he gave them a name, MSC. However, in the end of his career, he confessed that he perhaps made a mistake. And he said that it's not the mesenchymal stromal cells, it's better to call them medicinal signaling cells, because MSCs only produce the signaling effect or the pericrine effect, but they do not survive, they do not home into the tissue, they don't proliferate, and they don't differentiate. That's a fact. You know, so yes, medicine and science was under impression for many decades, for many years, that whatever we see in the Petri dish in the laboratory will happen inside the human body after the cells transplanted. Unfortunately, no. Those cells, they survive and differentiate and propagate, you know, expand volume in the Petri dish, in vitro, not in vivo. In vivo, unfortunately, scientists, no matter how hard they try, and doctors, no matter how hard they try, they cannot act God. However, the neural cells, the progenitor cells, do differentiate. So that's the main difference.
I apologize if I missed this at the beginning, but how are they transplanted, surgically or intranasally? Or?
Oh, that's a topic for perhaps a topic for a huge medical symposium, you know, because there are multiple routes of administration, and there is no perfect or ideal method of administration for different case, different types, for different cell preparations. So the concentration can be intrathecal, it can be surgical, can be deep intramuscular, or create the stem cell niche and implant there. So there are multiple routes.
Okay, and have you done any work with traumatic brain injury, with areas of the brain that have been lost completely?
Traumatic brain injuries, no. We had a number of patients with stroke, including the young patients, those who develop stroke because of the antiphospholipid syndrome. And yeah, it really makes wonders, you know. However, the traumatic brain injuries and spinal cord injuries we yet to see. So if you have some cases, we would have
I have one.
loved to look into that. Years ago, perhaps, yeah.
Sorry, I'm sitting here.
For Alzheimer's question, what
Yes, sir.
are you having the patients do things concurrently, as far as exercise, medication, diet?
Oh, yeah, absolutely.
Okay, so
First
there's
of
a
all, it has
slew
to
of
be
things.
holistic and integrative medicine. We are very inclusive as long as the treatment modality is proven safe and it doesn't have any negative interactions and some massive side effects. But yes, you see, even the dietary and the lifestyle modifications. So, number one, the first dietary modification that we do for patients with Alzheimer's specifically is inclusion of the MCTs, the mid-chain triglycerides, because brain, although it's only 2% of body weight, but it takes about 20% at least of the energy that we spend. And brain cells are perhaps the only cells that are dependent on the energy supply like every second, every minute. Sugar is the number one carbohydrates, but in case of the Alzheimer's, there's a downregulation of the insulin receptor, so the cells sort of do not recognize carbohydrates. So the use of the alternative pathway of nutrition, which are mid-chain triglycerides, but that has to be given in a fasted state, first thing in the morning, provided that the patient fasted at least 6 to 8 hours. Then you give them about 7 grams of mid-chain triglycerides, and they were not supposed to consume any other nutrients for about at least 1.5 to 2 hours after that. You know, so the brain only functions of the mid-chain triglycerides. So that would be the dietary step. Of course, the lifestyle modifications and all, removal of processed food, removal of the fast sugars, and also it has to be a lot of fiber also, yeah, because you need to feed the gut bacteria, probiotics, symbiotics, if necessary. And then stem cell treatment. A stem cell is a one-off implantation. After that, we put the patient on about 15 weeks at least of the mitochondrial mitoorganelle peptides and nanomyce peptides together with the exosomes. Exosomes are not given every day. We give them twice, thrice per week, whether the SPG block or the intranasal or the IVs. Of course, around the stem cell implantation, we give IV because exosomes penetrate through the blood-brain barrier, you know, so, and they also increase permeability of the blood-brain barrier. Plus, we add on hyperbaric oxygenation around the implantation. We add on transcranial stimulation that further aids, helps, you know, for the homing effect. So everything to facilitate, to squeeze maximum effect out of stem cell transplantation.
What about ketone esters? Ketone esters.
Ketone esters, that's for the brain nutrition and all, you mean, right? So
Right.
just
To get
well,
the ketone. Because that
uh,
bumps it up.
well,
That's in
that would be more towards like a dietary modifications, you know, to push patient towards like a low sugar, more the ketogenic
Yeah,
diet.
but it's a lot
perhaps.
better than MCT.
That would make some help as well.
Yeah, it doesn't taste good, but.
Okay.
What's your success rate? Just
I beg your pardon?
success rate.
Success
Patient
rate.
variation, success rate.
Well, I come visit our website. You know, it's a very, practically we don't see patients who do not produce any response to therapy at all.
Everybody's welcome to actually go visit the booth and ask more questions and actually talk to Dr. Klokol after.
A multiple meta-analysis that have been published, they actually consider the neural progenitor stem cell transplantation a golden standard for the reversal of the neurodegenerative conditions.
Thank you, Dr. Klokol.
Thank you for your attention.